Welcome to another episode of WOCTOK. In this episode, we're going to talk about the ideal placement of leave-in dressings. The first question to be asked is, who do we place it on? We're going to be placing them on at-risk patients with any of the following issues. So brain less than or equal to 18, advanced age, prominent tailbone, poor sensation or poor vasculature, or prior pressure injuries, which all put the patient at risk for future pressure injuries.
All right. The next question we're going to ask is, where do we place it? On the sacral dressing, you want to palpate the coccyx, or you can just go 2 centimeters, guesstimate 2 centimeters up from the anus. And then for the heel leave-ins, we want the angel wings up towards the sky. And then this goes with the Achilles notch, because we want to protect the ankles as well as the heel when we put it on. The heel, these leave-in dressings have layers that reduce friction and displace pressure to help you and assist you with pressure injury prevention.
And the National Pressure Injury Advisory Panel does list the leave-in dressings as one of their recommendations for PI prevention because of the reason Thomas just stated.
When you're preparing to apply your sacral dressing, remember that you want to use the green wipes to clean the skin, because if you use the blue wipes, they have barrier cream in them and your dressing will slide all over. If you're taking off an old dressing, it's best to pull it down from the top. You want to cleanse your skin with the green wipes, and then you can either use the barrier wipes or the barrier spray, and I usually spray right around here and let it dry so that you can get the dressing to really stick. All right, if you have any questions, there's a step-by-step guide on the package. First, you want to take the middle of the dressing out and fold it like a taco. Then you find the coccyx bone and you want to line the tip of the dressing up with the tailbone and apply like this, and then you can come in and remove your other sides. These fenestrations are supposed to go around the anus so that the stool can come out on top, and then you would label and date.
All right, so next I'm going to show you how to apply the heel leave-in dressings. So what we can do is go ahead and remove our boot. Thank you, Thomas. So we'll get our heel leave-in. We'll go ahead and release the middle liner. So pull that off. I find it easiest to go ahead and lift the patient's foot up, line it up where I need it, and then placing it down and just letting it rest on the bed. That way you're not juggling, holding the foot while you're doing it. So the next thing we want to do is go ahead and release. I like to have the wings, of course they're facing up like Thomas said. I like to do the wings first, so we'll go ahead and peel that back. You stabilize her knee since she's a mannequin, like that. Peel that and kind of lay it across. And then the bottom two, they're actually best if we kind of aim them up and stick them to the other wing instead of sticking them on the skin. This makes it easier to check under them later. So we'll go ahead and do that. And then we can kind of press down to make it adhere.
Don't forget your heel, dude.
Some common questions that we've encountered are, what if my patient is incontinent?
Well, Liz, if the dressing is placed correctly, they are ideally supposed to be incontinent repellent. We would just have to wipe the outside of the dressing with just a wipe after stool or urine occurrence.
If you are finding that the patient is extremely incontinent and you're having to change the dressing more than once per shift, it's a good idea to go ahead and switch to the barrier cream. If it is a dressing with like a honey therapy or something like that, please contact WOC so we can change the orders accordingly. Another common question is, can my patient ambulate in heel dressings?
That's actually a really good question, and the answer is that you can. Just make sure you wear your protective foot socks.
Hey Megan, what if my patient has compression wraps?
We do recommend going ahead and placing the leave-ins under the compression wraps. We recommend offloading the heels with heel boots due to being unable to assess under the compression wraps while they're on.
So should I change my leave-in dressings when bathing?
It is unnecessary to change the leave-in dressing unless it's soiled or water gets underneath and it comes off.
If the leave-in dressings are wrinkled, do I have to change it?
It's actually unnecessary to change unless it's soiled or if it's so wrinkled that it does not provide protection to the area. Hey Thomas, can I place an leave-in over a wound?
Absolutely, you can. If you are placing it over a wound and there's no wound care orders, please consult us so we can make recommendations. Also, to take into consideration, if it's a BID or a daily therapy, such as Santal or Vinilex, you don't have to change the leave-in every time. You could just peel it down, apply the therapy, and place it back. But if it's a Q3-day dressing change with honey, then you can change it every time.
Can I place or should I place the leave-ins before surgery?
Yeah, you can, especially if you have time to do it during your shift. If you don't do it, the OR will do it. Just know that they're very busy and this would do them a huge favor.
Sure.
So in conclusion, we want to use our sacral and heel leave-in dressings on the pre-mentioned criteria, patients braiding of 18 or less. Use your nursing judgment on anybody you feel that's at risk. And remember, when you're using these dressings, they're only help, they're not 100% effective, so you still need to offload the heels with a pillow and the sacrum with a wedge or a pillow, and when you're turning and offloading.
And we also wanted to remind you how to chart this dressing. So in the skin intervention section, the comment silicone foam dressing in place is how we recommend charting that these dressings are on.
Some common questions that we've encountered are,
There's the press lever.
it's soiled or if it's wrinkled so badly that it's not, does not
provide protection. Yeah, okay, you bet. If they do have compression wraps, we recommend offloading the heel boots. Pause. Offloading the heel boots.
Many leave-ins were harmed during the making of this video.